All right. So today we're going to talk about physical therapy and acupuncture in reference to breastfeeding and chest feeding. And we have Nancy and Genevieve here. I'm not going to say your last name, Nancy, because I don't know if I can get it right. But I will let you both introduce yourself in a second. I'm just going to thank our sponsor, Dirigo Pediatric Dentistry in Yarmouth, for their support. And I will put their link in our chat. And then if anybody has questions, feel free to put those in the chat and I can, we can answer them throughout, or we can wait at the end, whatever works better for the flow. And so feel free. I will hand it over to Nancy and Genevieve.
All right. My name is Nancy Charlebois. I'm a physical therapist and massage therapist, and I specialize in pregnancy and postpartum women's health as well as pelvic health. And I love working with our breastfeeding and chest feeding moms. And specifically today, I'll speak a little bit about how physical therapists treat clogged ducts. And looking forward to sharing that information with you.
And I'm Genevieve Sprinkle. I'm a licensed acupuncturist here at Jade. I work with Nancy. We have a very integrated practice. So I often do acupuncture on her pelvic floor and pregnant and postpartum women who come in to see her. I do acupuncture on a lot of other things as well. But today I'm going to talk specifically about what acupuncture can do to support a breastfeeding mother or a chest feeding mother, and that can help with issues that might come up around breastfeeding. So I'm talking about traditional Chinese medicine. As an acupuncturist here in Maine, one of the other things that I do is I prescribe Chinese herbal medicine, and I sometimes do use that. But I want to talk a little bit for some of you about what traditional Chinese medicine is and how it's practiced in the United States. We use acupuncture. We use filiform needles on acupuncture points, but we also use moxibustion, which many of you may have heard about. We use that to turn babies. So between 32 and 36 weeks, if a woman has a breech baby, moxibustion on one of the acupuncture points on the little toe can actually get the baby to turn. So we use that. We teach that to our parents to be so that they are able to do this at home. And that seems to support them very well. There have been clinical studies done, and it is shown to be efficacious for getting babies to turn. So often, the first time I may see a healthy mother is at that juncture. She may be coming in at 32 to 36 weeks for moxibustion. Sometimes I use needles as well, just to get her relaxed. And I invite her to come back between 36 and 40 weeks to help support her going into labor. There is an acupuncturist and midwife whose name is Deborah Betts. You can find information online about her. She's written several books, and she authored a study in New Zealand quite a while ago, maybe 15 years ago, where she taught midwives there to do some very simple acupuncture. And what they did was between 36 weeks and 40 weeks, they did a once a week session with some acupuncture to help get the woman ready for labor. And what they found, which was especially interesting for first-time mothers who often are late, is that the women went on time, much, much closer to their due dates. They had shorter labors, and they had less complications in labor. So it was a win-win. So I try to get my women to come back and do this. And I find that, especially with my first-time moms, it gets them very ready. And I bring this up because when we're talking about breastfeeding and postpartum, prepartum care before you go into labor is very important. And getting a woman to relax and know that her body and to trust herself going into labor is a really important thing. So that is one of the ways that I feel I help. So I don't often see the women I do that with come back with breastfeeding issues. So I think that's a really important thing, is it's preventative. So acupuncture or traditional Chinese medicine is really a holistic method of healthcare. And it's based on the philosophical tenets of Taoism, which is a really, religious belief and system, a spiritual system in China, in ancient China. And it really is about bringing the person back to a state of balance, of healthy balance. And we use acupuncture, we use moxibustion, which is the heating of acupuncture points, with moxa, which is artemisia. And it's a very blood moving and chi moving herb. So not only is it about the heat, but it's also about the essential oils that penetrate the skin to make things happen. We also do diet and herbal advice, and we often prescribe herbal formulations for our patients. We also know and value and teach meditation and Qigong practices to help calm the nervous system. So what is Qi? You see an acupuncturist, an herbalist, and we talk a lot about Qi. And I like a couple of very modern interpretations of Qi. Qi is intelligent and organized metabolism. We all want intelligent and organized metabolism in our bodies. Qi is visible in the same way that electricity is visible, through its effects. So when we look at contemporary studies and Western studies of how acupuncture works, it's very difficult to do double-blind studies because of the nature of how acupuncture works. So how do we measure it? Even in studies where people have chosen sham acupuncture points that are not necessarily the points we would use for a particular thing, that we're still moving qi, and it's still valuable for calming down the nervous system. So people get benefits even if you don't pick the right points. So that's makes it a little bit difficult. One of the things that we're doing when we are doing acupuncture on a particular point or on a system of points is we are moving stuck qi. When the qi is not flowing through the meridians in the body, the electrical energy is not flowing properly, it hurts usually. And because it's like, if you think about water and a dam holding back a floodgate, that is what often happens for us, is that sometimes in our body, the qi is not moving, it's not flowing. And when it gets backed up, pressure builds up. Pressure can cause heat. It can cause inflammation. It can cause engorgement in the breast. So one of the things we're doing when we put needles in is we are moving qi and establishing a free flow of energy through the body so that the body will do what it is supposed to do. So when we think about mastitis, when we think about engorgement, when we think about blocked milk ducts, or even low production of breast milk, all of those can be thought of as stuck qi. Now, why is the qi stuck? That is something that when you see an acupuncturist, they're going to determine, because we treat the individual. We don't treat the engorgement. We treat the woman who has engorgement. Why is this happening for her? And in Chinese medicine, we also think a lot about emotions and how a person's emotional state can influence their body, their physical sense. That can be a reason why qi is stuck. Sometimes it can be from deficiency. Maybe they're exhausted. Maybe they are nutritionally deficient and cannot produce enough milk because their nutrition is so poor. Or maybe they lost so much blood during labor that they are now slightly anemic and blood deficient, and their chi needs to be boosted. So that is often when we would use herbs. So when we're treating, for instance, the insufficiency of breast milk, say often women are very concerned that they're not making enough breast milk, especially first-time mothers who are nursing for the first time. It could be emotional. It could be that they're just stressed out and anxious. Or it could be that they're just deficient, or there could be a blockage. So some of the studies that have been done specifically about acupuncture and using this to move chi and to help and that have shown clinical efficacy revolve around electrical acupuncture. So there are 2 points that were used. There was one study that was done for insufficient lactation that used 2 points on one of the channels that end at the little finger. In Chinese medicine, in traditional Chinese medicine, every acupuncture point has an energetic that it is thought to help work with. And one of the things about this particular point was that it is used to increase blood flow, chi flow to the breast in general, and also produce. So they tested it, and what they did was they did just no other points, just simple stimulation for a short amount of time, 15-20 minutes, on these points on the little fingers with electrical acupuncture bilaterally, both fingers. And what they found statistically was that it did increase prolactin. It increased, they weighed the babies over the course of the time they were doing this study. They were doing it once a day for a week. They noticed that the babies were thriving, their weight was going up, and that the mother's perception of her breast milk production was also positive. So I have a link that will be put up in the chat to a bunch of different studies that have been done showing some interesting statistical evidence for using acupuncture to increase breast milk and to help with engorgement and mastitis and plugged ducts. So we'll have that for you. One of the ways that acupuncture shows clinical efficacy overall is it's been shown to treat various autonomic nervous system disorders, including anxiety and nervousness. And how does it do that? It really seems to control the functions that are measurable for us, such as blood pressure, pupil size, skin conductance, skin temperature, muscle sympathetic nerve activities, and heart rate. So all those things can be measured when we put acupuncture points into the body, into a person, and we can see that it's actually doing something. So using acupuncture to calm the nervous system down for a worried person or an anxious person helps tremendously. It's one of the biggest things we do. Moving chi through the channels that course the breast and helps to stimulate the hormones that trigger letdown and help move the chi through there. Nancy, can you put that up for me? Yes. I'm going to share a diagram of the breast showing the major channels for you to see how these channels go through the breast tissue.
Just take me a sec.
Great.
Right.
So there are 12 main meridians that have acupuncture points on them that correspond with, they're called their organ systems, is basically what they are. And I'm not going to get into that deeply because it's complicated. But the central channel, The blue channel on your screen, that one, that is a central, that is a deep, extraordinary meridian. That also has acupuncture points, and we call that the Ren in Chinese medicine. That is a point I often use for all kinds of gynecological things. And there is a point too that is on this channel that it really corresponds with the heart chi and is very close to the breast. So I will often use that point, Ren 17, and that is one that has shown clinical significance in helping to increase blood flow, chi flow through the breast. And then you will also see these other two channels. The yellow one going right through the nipple, that is the stomach channel. And there are points right below the nipple. We never needle the nipple. That's a no-no. That would not feel very good. It's enough to have your little one, you know, sucking on you or biting you. But below the nipple is a couple of points that are very good for stimulating the breast and helping with all of these things. And that is stomach 18. So you can see where the channel flows right through the breast. There are spleen and liver points also on those channels that we use. And there are kidney points. The black line on to the left on the inside, those, oh no, this one over here, this closer to the blue, that one, that is the kidney channel. And the kidney channel and kidney energy is very associated with the adrenals. So when a woman is really depleted, we might choose to use points on that channel. Now that shows you an area around the breast. We would use some points around the breast as what we would call local points. An acupuncturist would do that. But depending, we don't treat the disease. We treat the woman who's got this situation. So what we would do is we would use our diagnostic tools, talking, listening, touch. We would feel the pulse, we'd look at the tongue, and we would determine why that energy was stuck. Why was the breast milk not moving? Why is it deficient? And once we've made a clinical diagnosis with the patient there, which is really quick, then we might choose points on those channels, but the kidney channel goes all the way down to the feet. We might use some points on the feet because that will move chi in that channel that goes through the breast. Same with the stomach channel. Same with the liver channel. So that is how acupuncture works. And we would not just use the same prescription for every single person. We really do treat the individual. There was another study in Sweden that was done. They were using this in hospitals there to help women with engorgement. And what they found was that women were less likely to develop an abscess or have the mastitis or go into full blood, full force mastitis when acupuncture was employed. And they used at that point in that study, and it's also in the link that I sent you, they had a control group. So what they found was that by day 5, that their symptoms were less severe and that they had a lower rate of fever compared to the control group. So it was less likely to go into infection, and if it had already, it was more likely to clear an infection. I'm not going to go into specific points that we do.
Sorry, what was that?
Somebody just joined and they're not muted yet, so.
Okay.
About that.
So the other thing that I wanted to mention just briefly was, I think that there are quite a few, if you go online, I was looking, there are quite a few breast teas these days to enhance breastfeeding. And there are all kinds of formulas with lots of different herbs in them. 2 that I looked at, I think one was called Traditional Herbs and another one was like Mother's something.
Mother's Milk, I think.
Yeah, I think so. So I looked at those formulas because I was really curious to see what was in them. And those formulas are Western formulations. There is a difference between the way that Western herbalists practice and the way that traditional Asian medical practitioners practice with herbs. But one thing I will say is that there are two herbs that we use in the pharmacology of Chinese medicine that we're taught and use to help improve breastfeeding and to improve the amount of breast milk that's produced. And those herbs are often found in these teas. So if you want to use one of these teas, I would recommend that you make sure that these particular two herbs are in the formula. One is fenugreek, which we call hulu ba. And what's interesting about these herbs, or that the way that we look at them, is we look at the quality of the herb. What is its taste? What is its temperature? And what channels does it go to? Because with this, I'm showing you this breast with these channels going through it. If the herb actually has an effect on those particular channels, it's going to work for that. And so fenugreek is bitter, it's warm, and the liver really loves bitter. And so that's an interesting thing. And it's warm, so it heats things up a little bit if there's not enough and the things are cold. And it goes to the kidney and liver channels, and both of those channels transverse the breast. So we've often known that it increases lactation, and it does so in a way that doesn't mess with your sexual hormones, with your sex hormones. So that's a really good one. The other one is fennel, and fennel is xiao hui shang in pinyin. And that's one I see a lot in formulations. And I will say that we don't use it for this. And it seems to be a big one. So if you are looking for a formulation to try to increase breast milk, I would say fenugreek is the one I know works the best. And that fennel is a secondary herb that you can use. And I in looking at why it might work, it's acrid, it's warm, and it also goes to the liver, kidney, and spleen channels. And those channels would be why it would work, because they transverse the breast tissue. But it's not a traditional usage in Chinese medicine. So I would say if you're going to use a formulation, make sure it has fenugreek in it. And then the other ingredients that are in the teas are not necessarily common herbs that we use. They tend to be more Western and traditional herbs, and really it's out of the scope of my practice today. So if you have any questions now, I'd be glad to answer anything I can for you.
And I will pull up the chat just to see if there's anything in there question-wise. All right.
If you have questions, feel free to unmute yourself. All right, maybe you want to think it through, hold them to the end. And why don't I speak a little bit? And if you have questions, you're welcome to type them in the chat. We'll check in with those at the end. Or if you have questions and you want to unmute yourself at the end, that would be great as well. So as a physical therapist, the way that we treat women's breast health is usually a lot of education. Our scope is probably a little bit narrower than what our acupuncturist and Eastern medical providers have. So as a physical therapist, most of what I'm working with my pregnant patients is a little education about how important it is to work with probably a lactation consultant in terms of bra fitting for postpartum, especially with nursing, and getting really good fit and the importance of that for overall breast health. And then postpartum women are referred to me particularly if they have a clogged milk duct. Outside of that, with breastfeeding, we're really just working on postural awareness, ergonomics with good breastfeeding position, but we're not lactation consultants. And a lot of the women that we see are already working with a lactation consultant that are helping with those things as well, which is great. If they're not, we tend to like to refer them back to a lactation consultant because the team approach seems to work really well, and make sure that the baby and the mom are getting everything they need from all angles. So in treating clogged milk ducts, I think that it's not common for people to know that physical therapists can treat that. It's even some physical therapists are surprised that there are some modalities out there that we can use to treat that. So Amanda has put up a study, I think it's from the National Institute of Health, that talks about a protocol using ultrasound therapy. And so I'll go over that in a few minutes. But when a woman comes in for her evaluation with me, we spend quite a bit of time talking, just finding out how everything's going overall, how their postpartum recovery is going. But being referred for a clogged milk duct, typically there's pain, and I want to know more about that, where it is, the frequency, the intensity, and anything else that may be going on with their breastfeeding experience. Moving into the more objective side, I do a breast exam as long as the woman will consent to it. And so we're all expert drapers, which is great, so that we can see what we need to see without them feeling exposed. But if they give consent, it is really important to just look at their nipples. We want to look at symmetry. We want to look and see if there's any skin breakdown, if there's redness anywhere in the breast, if there's swelling. And as you all probably know, women are really good at knowing their bodies, and especially breastfeeding, and where the problem may be. So after really looking at the breast, I'm asking women, you know, can you feel the clogged duct? Can you show me where it is? And I will palpate everywhere from the clavicle down into the sternum, through the whole breast, around into the axilla, right? Because there's still breast tissue there. So there's a lot of feeling, and even if there's a clogged duct just on the one side, we like to compare and check both sides. So again, it comes back to treating the whole person and looking for, if there's nothing going on the left, getting that as the unfortunate quote unquote normal side, and comparing and seeing where we need to go. So also look at posture. Posture is really important. In pregnancy and postpartum, as women get really pulled forward, which again can be difficult from an acupuncture standpoint. I imagine it closes channels.
It does.
And can create stagnation. And from a pure musculoskeletal point, it creates soft tissue tightness and compression. So the postural evaluation is really important, and we do a lot of education around that for women. And whether it's posture for just standing, or posture for just thinking about it when you're changing a diaper, or looking at ergonomics, different positions to be in, and how to set yourself up well for a nursing position where you can be comfortable, the baby's really comfortable and nursing well. That's really important. Let's see, we'll also look at how women's necks and shoulders are moving as well, right? So when you have pain in one area, we want to make sure that we're clearing the neck and the shoulder around the breast to make sure there's not some restriction going on in another part that's affecting breast tissue health. So we'll look at how the neck and shoulder are moving, and we will also look a little bit at strength and making sure that there's symmetry side to side, particularly in the shoulders and the upper back. Okay. Let's see. So treatment, after we've gone through the evaluation and clarified where the clogged duct is, we use therapeutic ultrasound. There's very little that I do in my practice that is a protocol, but this is a protocol. And with therapeutic ultrasound does not give me a picture back. It's not like a fetal ultrasound that I can see a clogged duct. The sound waves penetrate into the tissue and get cells vibrating. And that cellular vibration is what starts to clear the clogged duct just by getting movement there. And so the protocol is in the study that Amanda put up as a link. And so we're using continuous ultrasound. There are different parameters to use ultrasound. If you're not a physical therapist, chiropractor, or physician, it's not something you'll have access to. But if you were needing this modality, you can pull up the studies if your provider isn't aware of the parameters to use, and just use these parameters. So we're using continuous ultrasound at 1 megahertz directly over the clogged duct. And what that looks like is the frequency is usually twice a week for 4 to 6 treatments. And it's basically until the clogged duct is cleared. So that could happen after 2 treatments. It could happen after 6 treatments. Everybody is just a little bit different. When we use ultrasound, it tends to be relaxing. The woman may feel some warmth around the breast tissue. We're continuously moving the ultrasound head so that it doesn't feel too warm, because it tends to create heat or friction. Or vibration. And so we're moving that ultrasound mostly right around the clogged duct in the tissue around it. So we'll use. I
have a question, Nancy.
Yes, go for it.
I have heard that there are some like massagers that you can use like that will vibrate, that you can put on your breast. Do you think that works in a similar way? Or do you think the ultrasound can be more effective because of the warmth?
The ultrasound is probably going to penetrate into a little bit deeper into the tissue. The massagers aren't going to create cellular vibration. They'll create overall soft tissue vibration. But I don't discourage women from doing that, from using massage tools. I do also teach them self-massage, right? So self-massage of the breast. While they're in there, I will usually start with ultrasound, then I will do some breast massage and maybe some myofascial release, getting those connective tissues around the breast to release. But certainly at home, if they're more comfortable using some kind of massage tool or massager, that's fine, as long as it's not painful. So you know how there's like good sore and you can use a massager and it feels strong? As long as it feels good, that's fine. If it's stepping over the edge into pain, I usually say, it might be too much, back off. I'd rather have you use your hands, do some self-massage. So great question. And so after doing some ultrasound and some soft tissue work, I will usually do a fair amount of education around postural awareness and then some exercise. So, you know, I'm a physical therapist, so I'm biased. We're meant to move, right? So it's really important for a physical therapist to teach their patients movement strategies to keep those soft tissues around the breast moving well. So let me share my screen with you. These are some of the common exercises that I teach my patients. And so when they're in, we go over them together. And I demonstrate them to patients and then have them demonstrate them back. And depending, you know, every new mom's a little bit different. Some feel ready to take on a few extra stretches or exercises, and for some it's too much. So it's always meeting them where they're at. I encourage them to try to fit these in whenever they think of them. So for example, they're going to be doing multiple diaper change a day. Before every diaper change, maybe you do one of these stretches. And the ones that feel good, maybe those are the ones you pick to do the most frequently. And the ones that maybe you're not sure of or you don't feel stretched, that's okay. You can just move on and skip them. So the classic one is this doorway stretch. And I like this one because you can modify it. It's meant to stretch the pec muscles, right? And so it's a nice chest opener, creating space and decreasing that compression through the front of our body. Being in that first doorway stretch that's at the top of the page can be pretty intense. So basically the patient stepping through the door with one foot, it doesn't matter, and they can control and back off if it's too intense. But even still, if it's too much for them, they can go to that second one down below where their arms are down lower. It's still a nice pec stretch. It stretches different fibers of the pec muscles and tends to be a little less intense. So if the top one is too much, I have them start with the second one and then move their way up to the full doorway stretch. The book Opening Straight Arm is our next one. I really like this because it's dynamic. As you can see, they're laying on the side. The woman in the left picture in her start position is here, and it's a dynamic opening and closing motion. I really like the dynamics of it. It tends to feel good, mostly because a lot of what women are doing postpartum is forward and back, right? And now we pull some rotation in, which again is great for our soft tissue health, so we don't get caught up in those repetitive pain or repetitive strain strategies. Very rarely through the day are we moving in this rotation, so it's a nice way to bring a new movement pattern in. And again, it's a chest opener, and it really is nice for the shoulders as well. Moving down, this is a nice, easy one, the anterior upper quadrant stretch. I like it because it's dynamic, because a woman is actively using her upper back, right? So the doorway stretch, you're stretching, but you're not really working. When you bring your arms back to open up your chest, your upper back muscles are working, which is the flip side of a stretch, right? So now we're not just stretching, we're actively engaging our upper back muscles. The more that we do that, the more those muscles are cued to put you in good posture. So as you keep working through that through the day, your postural muscles remember to stay open. Okay. If women have foam rollers, or they could use a long rolled up beach towel right under their back, under their spine. Ideally, their head is supported. Snow angels are nice. Again, a nice dynamic movement. This one is harder than it looks. You're trying to keep the backs of your hands back on the floor. Again, for most of us, because we're in front of computers, we're doing childcare activities, we tend to get very tight in the front. So that movement of bringing your arm overhead while keeping it open through your chest is difficult. But again, with breastfeeding, with any type of breast pain related to a clogged milk duct, that opening can feel really good. And then lastly, the chest stretch on the foam roller or a long rolled up beach towel is just pulling those elbows back. And again, I like that because it's actively engaging the upper back and stretching the front of the pecs at the same time. So these are some of the typical exercises that I'll give to patients. It's a good place to start with anyone with coming in with that clogged milk duct. So yeah, that's in a nutshell what we're looking at in terms of physical therapy. Does anyone have questions?
I'm wondering if you give advice around bras, or if you find that, you know, those can cause problems sometimes with them being too tight and causing the clogged ducts or around that.
Yeah, I think Genevieve and I are both on the same page about no underwires.
Absolutely no underwires.
No underwires, and a really good fit. Sometimes I'll talk to women about how to lift their breast and fit it properly in the cup. And so that the band of the bra is, you know, around their trunk and not around some of the breast tissue. You want to move that breast tissue out of the way. But beyond that, I don't do anything. I send them to a lactation consultant for that info. Do you have anything you have?
I totally concur that you don't want to squeeze any breast tissue, whether on the side or, you know, that you want to make sure that the breast is in the cup and is not being squeezed anywhere. Because a lot of times, even on the side, you know, women are so much bigger and they're not used to that when they're nursing at the beginning, that they might be restricting the breast tissue. So you want a good fit, and I think a lactation consultant is going to make sure that happens, because you don't want, you know, if you restrict the flow of chi through the breast with a bad bra, you can have some real problems. And, we're all about that smooth flow of chi. So,
Right. And there are some stores that have employees who are educated in proper bra fitting. So I tell patients to ask for someone who's knowledgeable. So, yeah.
Anybody else have any questions? You can put them in the chat and I can read them, or you can unmute.
I was also curious about the breast massage that you were talking about. When I think about that sort of thing, I usually am doing like a spiral with small little circles kind of going through, but I wasn't sure for a clogged milk duct if that would be very different.
I'm not sure I can picture the spirals. Usually I'm clearing above the duct first and then below the duct, or the clog, I should say, above and below and around it before I'm working directly over the clogged duct, because that needs somewhere to go. So you have to open up the channels a bit to clear. And I think that's why doing the ultrasound first really helps, because it softens everything. So there's just a lot less manual work that has to be done, and it's more comfortable for the patient. So I hope that helps. So I clear around the breast tissue or around the duct and then start working with the duct. And I'm usually pressing towards the nipple. The flow is towards the nipple, not back up.
and if I do acupuncture with somebody who has mastitis or a plugged duct, I'm not going to put a needle in the epicenter of the plugged duct. That's not going to help. Much like Nancy, I'm going to go above it and I'm going to direct chi to the nipple so that flow happens, the natural flow happens. That's the way I'm going to choose points to work with that.
Mm-hmm.
So that almost sounds more like almost a philosophy behind like an edema massage, where you're trying to, like move things towards the lymph nodes so it can clear. Is that kind of the idea?
Yeah, so true edema, we tend to push centrally and is usually from the extremities. So we're pushing it towards the central part of the body. So I guess you could think of it as, yes, pushing it centrally towards the nipple. I don't do lymphedema purified, so I don't do anything with lymph. That's a whole different ball of wax. I imagine it could be really helpful. So.
Yeah, think about all the lymph that is here and how much that could back up if you have mastitis.
Right.
I think the open books would be particularly helpful with that sort of thing as well, because you're opening up through that entire arm line, all through the rib area. So I really liked that was part of your protocol, or kind of your normal exercises.
Yeah. In PT, they're unlimited. There are thousands of exercises. So it's always fun to pick them out and be a little creative, but also try to narrow it down so it's not overwhelming to our moms. Thanks, Bridget. Anything else? Any other questions, Bridget, or thoughts?
For my own breastfeeding experience, like I had a lot of issue with numbness and pain into my hands and forearms, because you're constantly doing that flexion all the way from like the shoulder through your fingertips. And so I've been treating, like I've just always put in, if they're having any issues like that, some really lovely like extensions, stretches all the way through. And it seemed like you could almost just incorporate that in with your dynamic chest opener by just turning the wrist back, opening the hands, and boom, then you've got the entire fascial arm line through there. And so not really a question so much as just a thought that for me and a lot of the women that I talked to and worked with, those are oftentimes co-occurring. And so just a nice little way to get a little extra.
Yes, absolutely. And I think when it's beyond the breast tissue, when there are symptoms beyond that, that's when our evaluation just really expands. So like numbness or tingling in the hands, we start looking for thoracic outlet issues, potentially carpal tunnel. I know that that's commonly diagnosed in pregnancy, but it's typically that thoracic outlet. And yes, anywhere you can introduce length for those symptoms tends to help. So are you do you work with as a lactation consultant, or it sounds like you work with a lot of maybe breastfeeding women?
Not exactly. My mother was a La Leche League leader for 35 years, so I grew up with breastfeeding women like everywhere. So so a lot of my experience with that sort of thing is not only in the clinic, but also outside. I haven't gotten to work with a ton of breastfeeding women outside or inside the clinic. But I'm hoping to do more, especially after this.
Right. You've had a complete education with Leche, I'm sure, with all that exposure. Anyone else have any questions? All right. I don't have anything else to add. Do you have anything?
I do
that you
not.
wanna- So
Just wish everybody happy breastfeeding.
yes, and thank you so much for having us. We're passionate about women's health, and it's lovely to be talking to other women.
Yes, thank you both. And this was from Jade Integrated Health. If you want to, I put the link in the chat also for that. We will have this recording on our website, and I will, add some of those links that you put in the chat on that too. So thank you everyone so much, and have a great weekend.
Thank you.
Thank you. Bye now.
Bye-bye.
Thank you.